Have you ever heard about the missing Malaysia Airlines Flight 370 in which 239 passengers were lost? This subtle news spreads almost immediately throughout the world. But how many people know this? About 5,000 people are dying from tuberculosis every day. That's like more than 20 planes crashing. When most people think of tuberculosis or TB, they might think of it as an old disease or disease of the past. But what if I told you that this disease of the past has returned with new phases that are incredibly hard to treat because they are resistant to our most common used TB drugs? It sounds incredible, but this is exactly what's happening now. This disease is the leading cause of death from infection, and this disease kills about 2 million people per year, and this disease is far from defeated. TB has re-emerged as a major public health problem. What we need are highly potent drugs, and we need them right now. To get highly potent drugs, I'm using a new strategy of drug design, the main idea of which is fragment-based drug discovery. In this case, instead of screening of large compounds, we did screening of small compounds which we call fragments. Why? With the small size of the fragment, they have fewer but optimal interactions with the target. First, I used computational methods to analyze how the fragment binds with the target protein. Then I did experiments to validate the computational results, and I found something that's really interesting. What I discovered was 2 fragments binding very closely to each other in the same protein pocket, and this result inspired me to make a further plan. Could I join both fragments together and make a new molecule? If the 2 fragments work together, the result could be higher active than just one single fragment. Turns out, it really works. From the computer simulation result, I saw that the new link molecule can remain in the exact same site in the protein as the 2 separate fragments, and that it has higher affinity to the protein target. My supervisor was also amazed at the exciting results I obtained, and now we are moving forward to the next stage of making real drugs. With this research, I hope that millions of lives will be saved from the TB disaster. With all the efforts, we will end TB once and for all.